Critical pH of developing cavity 5.5. Question: pH that enamel when enamel starts to demineralize 5.5. Next, what can tell best about caries? The past caries history. What can tell best thing about caries? Past caries history. Next, which is least likely to predict future caries? Answer: amount of sugar intake. Which is least likely to predict future caries? Amount of sugar intake. Because the other options are frequency of sugar intake and the amount of caries and restorations. So which one is the least likely to predict future caries? Is the amount of sugar intake. Next, 3 factors that affect caries initiation: the substrate, the bacteria, and the host susceptibility. Again, 3 factors that affect caries initiation: substrate, bacteria, and host susceptibility. Next, which of the following is the earliest clinical sign of a carious lesion? Which of the following is the earliest clinical sign of a carious lesion? Answer: a change in enamel opacity. The other options are radiolucency and patient sensitivity. But the right answer is which change in enamel opacity. That is the earliest clinical sign of a carious lesion. And the other options were rough surface texture and cavitation of enamel. But all of them are, which one is the earliest clinical sign? Change in enamel opacity. Next, what is true about strep mutants? And there is 4 options. They can live in plaque, they can live on gingiva, they can live in a child with no teeth, and has to live in a non-shedding surface. What is true about all this? The answer is has to live in a non-shedding surface. Has to live in a non-shedding surface. That is true. Next question. Most cariogenic sucrose. Which is the most cariogenic sucrose? Strep mutans adheres to the biofilm on the tooth by converting sucrose into an extremely adhesive substance called dextran polysaccharide. Most cariogenic sucrose. S mutans adheres to the biofilm on the tooth by converting sucrose into the extremely adhesive substance called dextran polysaccharide. Next, how do cells first attach? Dextran or lextran? Answer: dextran. Dextran. What is the most cariogenic sucrose? S mutans adheres to the biofilm on the tooth by converting sucrose into an extremely adhesive substance called dextran polysaccharide. How do cells first attach? Dextran. What is involved in the caries progression? Lactobacillus. Caries progression, lactobacillus. Next, what contributes to caries formation? Lactobacillus. Next, what helps in caries process, but it is not the primary initiation of caries? Lactobacillus.